Depression. Depression is a mental illness that affects a person's mood, thoughts, and behavior. It is not just simple sadness or a bad day. It is a condition that can last for weeks, months, or even longer, impacting daily life. People experiencing depression often lose interest in activities that once brought them joy, feel fatigued and low on energy, and even small daily tasks can feel overwhelming. Sleep and appetite may change, and negative thoughts about oneself, feelings of worthlessness, or guilt can often appear. Depression can arise from various factors. Sometimes it is linked to chemical imbalances in the brain that affect mood. Other times it is related to difficult life situations such as loss, trauma, or chronic stress. Genetic predisposition can also play a role. The good news is that depression can be treated. Psychotherapy helps change negative thought patterns and develop new ways of coping. In some cases, medication can support the recovery process. Additionally, support from friends and family, regular exercise, a consistent sleep routine, and a healthy diet can make a big difference. With the right care, people with depression can regain balance, energy, and joy in their lives. Bipolar disorder. Bipolar disorder is a mental illness characterized by extreme changes in a person's mood and energy. Those affected experience alternating phases of intense euphoria and overactivity, called manic or hypomanic episodes, and periods of deep sadness and low energy, known as depressive episodes. During manic phases, a person may feel excessively confident, sleep less, and make risky decisions. While during depressive phases, they may experience hopelessness, fatigue, and a loss of interest in everything around them. Bipolar disorder arises from a combination of genetic, biological, and environmental factors. There is a strong hereditary predisposition, and changes in brain neurotransmitters affect mood stability. Significant life events or stressful situations can also trigger mood swings. Managing bipolar disorder typically involves a combination of psychotherapy, medication, and support from family and social networks. Treatment can help stabilize manic and depressive episodes, reducing extreme mood fluctuations and improving quality of life. With proper care, individuals with bipolar disorder can live fully, maintain balance, and cope more effectively with daily challenges. Agoraphobia. Agoraphobia is a mental disorder that causes intense fear of open spaces or situations where a person feels they cannot easily leave or seek help. People with agoraphobia may avoid crowded streets, public transportation, or even leaving their home, as they experience strong feelings of insecurity or panic. This fear can significantly limit daily life and social activities. Agoraphobia is often associated with previous experiences of panic attacks or generalized anxiety disorder, but it can also be influenced by genetic and psychological factors. The person feels at risk or unable to control the situation, which triggers intense stress and avoidance. Treatment typically involves psychotherapy, mainly cognitive behavioral therapy, which helps the individual gradually face their fears and regain control. In some cases, medication is used to reduce anxiety or panic attacks. With support and practical practice, people with agoraphobia can overcome limitations and regain freedom in their daily lives. Schizophrenia. Schizophrenia is a serious mental illness that affects the way a person thinks, feels, and perceives reality. People with schizophrenia may experience hallucinations, such as seeing or hearing things that aren't there, and delusions, meaning false beliefs that feel real to them. They may also have disorganized thinking, difficulty concentrating, and challenges in managing daily life. The causes of schizophrenia are linked to a combination of genetic factors, chemical imbalances in the brain, and environmental influences such as traumatic experiences or stress. It is not the result of weakness or poor upbringing. It is a genuine medical condition that requires care and attention. Treatment includes medication, which helps reduce hallucinations and stabilize mood, as well as psychosocial support to strengthen daily living skills. With proper care, people with schizophrenia can maintain a stable and quality life, improve social relationships, and effectively face daily challenges. Social anxiety disorder. Social anxiety disorder is a mental condition that causes intense fear and anxiety in social situations or when someone feels they might be judged by others. People with this disorder may fear speaking in public, attending meetings, or even engaging in simple everyday social interactions, such as talking to a cashier. This anxiety can be so overwhelming that it impacts daily life, relationships, and work. Social anxiety disorder can result from a combination of genetic factors, personal experiences, and thought patterns. It is often linked to traumatic or unpleasant experiences in childhood, as well as neurological differences in the brain that affect stress responses. Treatment typically involves psychotherapy, such as cognitive behavioral therapy, which helps change negative thought patterns and reduce fear in social situations. In some cases, medication may be used to relieve symptoms. With proper support and practice, individuals can feel more comfortable, participate socially, and live a freer and more balanced life. Borderline personality disorder. Borderline personality disorder is a mental condition that affects how a person thinks, feels, and relates to others. People with this disorder often experience intense and unstable emotions, which can shift quickly from euphoria to sadness or anger. They may struggle to maintain relationships, fearing abandonment, or feeling extreme insecurity when they perceive rejection. Their self-esteem is often low, and their self-image can change constantly. The causes of borderline personality disorder are linked to genetic, biological, and environmental factors. Traumatic experiences in childhood, such as neglect or abuse, can increase the risk of developing the disorder. Treatment typically involves psychotherapy, such as dialectical behavior therapy, which helps manage intense emotions and develop healthier ways of handling relationships and conflicts. With proper support and guidance, individuals with borderline personality disorder can improve their quality of life, stabilize their emotions, and cope more effectively with daily challenges. Eating disorders. Eating disorders are serious mental conditions that affect how a person perceives their body and their relationship with food. Individuals with an eating disorder may overeat or severely restrict their food intake, induce vomiting, or engage in excessive exercise to control their weight. The most well-known forms include anorexia nervosa, bulimia nervosa, and binge eating disorder. The causes can be complex and include genetic, biological, and psychological factors, as well as social influences such as beauty standards or pressure to look a certain way. They are often associated with low self-esteem, anxiety, or suppressed emotions. Treatment involves psychotherapy, nutritional education, and in some cases, medication. Timely support and therapy can help individuals develop a healthy relationship with food, improve self-esteem, and regain physical and mental balance. Insomnia. Insomnia is a mental and physical condition that affects sleep, making it difficult or unsatisfying. People with insomnia may have trouble falling asleep, wake up frequently during the night, or wake up too early and be unable to return to sleep. This results in fatigue, reduced concentration, irritability, and decreased daily performance. Insomnia can stem from stress, anxiety, depression, or other mental disorders, as well as physical factors such as pain, health problems, or poor sleep habits. Often a combination of psychological and physical causes sustains the problem. Treatment includes behavioral and lifestyle changes, such as maintaining a consistent sleep schedule, avoiding caffeine and electronic devices before bed, and practicing relaxation techniques. In some cases, psychotherapy or medication may help restore sleep. With proper care, individuals with insomnia can improve sleep quality and regain energy and balance in their daily lives. OCD. Obsessive-Compulsive Disorder, or OCD, is a mental condition that causes recurring, unwanted thoughts and behaviors that a person feels compelled to perform. These thoughts, known as obsessions, can trigger intense anxiety or fear, and the behaviors or rituals, called compulsions, are performed to reduce this tension. For example, someone may repeatedly wash their hands or check over and over to make sure a door is locked. OCD arises from a combination of genetic, biological, and environmental factors, brain changes that affect the regulation of thoughts and emotions, as well as traumatic experiences or chronic stress, can contribute to the development of the disorder. Treatment for OCD typically involves psychotherapy, mainly cognitive behavioral therapy, which helps reduce repetitive thoughts and behaviors. In some cases, medication may also be used to relieve symptoms. With proper care, individuals with OCD can improve control over their thoughts, reduce anxiety, and live a calmer and more balanced daily life. Narcissistic personality disorders. Narcissistic personality disorder is a mental condition that affects how a person sees themselves and relates to others. People with this disorder have an intense need for admiration, feel superior or unique, and often struggle to recognize or empathize with the feelings of others. Despite an outward appearance of confidence, there is often a hidden sensitivity to criticism or feelings of insecurity. Causes may include genetic and biological factors, as well as environmental influences, such as being raised in an environment where the child is either overprotected or lacks adequate emotional support. Treatment involves psychotherapy, which helps individuals recognize their behavioral patterns, improve relationships, and develop healthier ways of interacting with others. With support and therapy, excessive self-focus can be reduced, empathy can increase, and quality of life can improve. Sexual dysfunction. Sexual dysfunction is a condition that affects a person's ability to have a satisfying sexual experience or express their sexuality as they wish. It can manifest in various ways, such as difficulty achieving or maintaining an erection, problems with orgasm, reduced desire, or pain during sexual activity. These symptoms can cause significant anxiety, guilt, or shame, and can impact personal relationships and self-esteem. Sexual dysfunction can stem from physical factors such as hormonal changes, health problems, or medication side effects, as well as psychological factors like anxiety, depression, or traumatic experiences. Often the cause is a combination of both physical and psychological factors. Treatment includes medical evaluation, psychotherapy or sex therapy, and in some cases, medication. With proper support and treatment, individuals can improve sexual function, boost self-confidence, and enjoy healthier and more satisfying relationships. PTSD. Post-traumatic stress disorder, or PTSD, occurs when a person has experienced or witnessed a traumatic event, such as an accident, assault, natural disaster, or war experience, and continues to be affected by it for a long time. People with PTSD often experience intense memories or flashbacks of the trauma, nightmares, and feelings of heightened insecurity and fear. They may also avoid situations or people that remind them of the event, feel constant tension or hyperarousal, and struggle with sleep or concentration. PTSD arises from extremely traumatic events that exceed a person's ability to emotionally process them. How the mind processes the trauma, along with genetic and biological factors, can determine the severity of the symptoms. Treatment includes psychotherapy, such as cognitive behavioral therapy, or EMDR, which helps the individual process and confront traumatic memories in a safe way. In some cases, medication may be used to reduce anxiety or depression, which often accompany the disorder. With proper support and treatment, individuals with PTSD can regain a sense of safety, reduce symptoms, and improve their quality of life. Phobias. Phobias are intense, irrational, and often debilitating fears of specific objects, animals, situations, or activities. A person with a phobia does not simply fear something in a normal way. The fear is so strong that it can significantly impact daily life. For example, someone with arachnophobia may avoid places where they might see a spider, while someone with a fear of flying may avoid air travel entirely. Phobias can arise from traumatic experiences, genetic predisposition, or learning through observation and imitation. The brain links an object or situation with intense anxiety, creating a cycle of avoidance and fear. Treatment primarily involves psychotherapy, such as cognitive behavioral therapy, and often gradual exposure to the feared object or situation in a safe way. In some cases, medication may be used to relieve anxiety. Substance use disorder. Substance use disorder is a mental condition characterized by the uncontrollable use of substances, such as alcohol, drugs, or prescription medications, despite negative consequences in a person's life. Individuals with this disorder may struggle to control their desire to use, increase the dosage to achieve the same effect, and experience physical or psychological dependence. Substance use can affect work, relationships, health, and overall quality of life. Treatment usually involves a combination of psychotherapy, rehabilitation programs, support groups, and in some cases, medication to address dependency and withdrawal symptoms. Panic disorder. Panic disorder is a mental condition characterized by recurring, sudden, and intense panic attacks. During an attack, a person may experience overwhelming fear, rapid heartbeat, shortness of breath, dizziness, or a feeling of impending doom, even without any real danger. These attacks often occur unexpectedly and can cause significant anxiety about when they will happen again, leading to avoidance of certain situations or restriction of activities. In some cases, medication is used to reduce anxiety and panic episodes. If you enjoyed this video, don't forget to like and subscribe. See you very soon in the next video.